And I think Prof. Aisha will modulate this whole meeting. I'll come back at the end. Okay, Prof. Aisha, over to you.
Thanks, Mr. Wong. I think thank you very much for the kind introduction. Well, I'm actually not the head of the breast surgery unit. I'm doing more on the research side. Okay, but anyway, let me invite Prof. Ho. Is Prof. Ho there? Prof. Ho? Maybe we can get Prof. Ho on video, because how are we going to do this? Because we don't have much time, and I would really strongly advise anyone who has questions to put it in the chat box so that we can quickly answer your questions. While waiting for your questions, yeah, Prof. Ho, are you there?
Speaking.
There you are. Okay, so I think we'll run this quite in a way that we try to answer most questions as given in the chat box. But while waiting for the chat box, maybe we can start off with the first question. There's actually a question there, okay, on whether patients in ppum provide vaccination to cancer patients in our hospital, because some patients in IKN do get their vaccinations in IKN. Would you like to answer that, Prof. Ho?
Is the cancer patient with ongoing chemo treatment advisable to take vaccine? Currently, we advise the cancer patients on treatment to consult their oncologist to get permission to have the vaccine. Most patients will be suitable unless the patient is on a very toxic chemo regime, or the patient is very weak or moribund or bedbound, then that may not be a very suitable time. Otherwise, cancer patients on or off treatment are encouraged to take the vaccine ASAP.
Okay, so I think there was a few questions here. So you answered the question on people who are going for chemo, are they advisable to take vaccine? So I think the answer is yes, right?
Yeah.
So the timing may be of importance because it really depends on whether the people can mount a good response to the vaccine. Because when we are doing chemo, what happens is the white blood cells become low, and hence your body is not reacting to mount a response to the vaccine in an optimal manner. Right, Mr. Prof. Ho?
Yeah.
So when is the best time? When is the best time?
Ideally, if the patient has not started on chemo, you have the vaccination now would be a good idea. When you're on chemo, if the chemo is for, let's say, 3 to 4 months, it's a high-risk chemo, i.e. a toxic chemo regime, then wait until the chemo has ended, then you have the vaccination after that. That is also a good idea. But some patients are on chemo long-term, i.e. they have one chemo after another, or they're on maintenance chemo, then there won't be a stop time for the chemo. So as far as we are concerned, with the patient's immune system is not too compromised, i.e. you check the bloods, the white count is okay, they are reasonably fit, they can take some of the side effect of the vaccine, then most patients should be suitable for the vaccination.
Okay, good. So that means the best time to use the chemo is when your neutrophils or the white cell count is at its optimal highest. And that usually is at the 3rd week, isn't it? After the chemo.
Yes.
Right?
Yeah.
Yeah. So you can talk to your oncologist and see how you can plan that vaccination time. So that is why I think it's very important. There are slots available. Even in ppum, we do have slots given to each department for our patients to get vaccinated in the hospital. So this is where I think this type of patients who are on active treatments, on chemo and other immunosuppressive treatments like the cyclips, right, Dr. Prof. O? Maybe you want to share what are the other drugs that can affect the immune system of the cancer patient?
Well, the systemic treatments, there are a few types. There are the chemos, there are the targeted therapy like ribociclib, palbociclib for breast cancer. There are the immunotherapy and hormonal treatment. There is a question here about hormonal treatment, which I'll come to in a minute. The more myelosuppressive regime would be the chemotherapy. And not all chemotherapy regimes are very myelosuppressive. Some are more myelosuppressive than others. For example, a sarcoma chemo regime would be more myelosuppressive.
So maybe, Prof. O,
yeah,
I raised up my hand because we need to reduce the medical. Yeah,
Myelosuppression suppress immune system more. Yeah. So not all chemo regimes are very toxic to the immune system. Some are more toxic than others. So regime for, let's say, colon cancer is not very toxic to the immune system. So the immune system is usually not affected. Regime for breast cancer is usually more toxic to the immune system. And regime for hematological conditions like leukemia is usually very toxic to the immune system. So different chemos have different side effect profile. So, but most patients, unless they are under very toxic chemo regimes, there should be a suitable time for them to have the vaccination, even during the chemo. Of course, if the chemo is only for 3 to 4 months, then you can have the vaccination before or afterward. That would be ideal. But in the less than ideal scenario, the cancer patients don't need to have the vaccine. Everybody else have the vaccine and they'll protect you. Except that doesn't seem to be the case in Malaysia. So that means the cancer patients are more vulnerable. They should vaccinate themselves to protect themselves. Yeah.
Okay, and then so that we can answer the question. So Ming asked everybody about after she's completed everything last year, can she take her vaccines? I think yes. You have completed all the immunosuppressive therapies in the past. You better go on for your vaccination. Your question about the blood clots, we leave it to the end, okay? So we'll take the next one. The next question was also again 5 months ago. Mandy completed her last chemo, so definitely she should go ahead and get her vaccination as soon as she can, right? Okay, somebody asked this question. My white cell count still is very low, 2.3 only. Can I go for the vaccine? Prof Ho.
Can't see why not. This patient has triple negative breast cancer, completed chemo and radiotherapy more than a year ago. Yeah, so this patient should be able to have the vaccine.
Yes. Okay, so that answers your question, right, Sally? Okay. All right. So as not to go too fast to the side effects of vaccine. So let's talk about the other treatments. So a lot of questions about hormonal treatment. So hormonal treatment does not affect the immune system. So that's okay, right, Prof? You want to say more about people on some drugs that they are taking together with hormonal treatment for, let's say, metastatic breast cancer? Do you want to have some comments about those drugs?
The targeted therapy, as a rule of thumb, targeted therapy does not affect the immune system so much. Even the cyclic drugs, we call that CDK4/6 inhibitor for breast cancer, they do drop the white count, but they don't actually kill the immune cells. So the patients are still immune competent. So even if patient is on CDK4/6 inhibitor like ribociclib, palbociclib, abemaciclib, and their blood count tends to be quite low, there is no reason why they can't have the vaccination. There's a different question is whether the body can mount the immune response if they have the vaccination. If the immune system is being suppressed, then you may not mount as much immune response. So the efficacy may drop a little bit if patient continue to take chemo or to take the targeted therapy. But in terms of the safety, that shouldn't be an issue. It's not really a virus that you are injecting. It's just a viral RNA or viral DNA or the dead virus tissue.
Okay, so I think quickly, maybe we answer this question. Is all the vaccines that we procure in Malaysia safe for cancer patients? Short answer? Yes,
yes.
right? Yeah, yes, because we
Yeah.
are not using the killed virus, you know, the live virus.
Yeah.
Because in the past we use this type of attenuated, or we make it weak, you know, these viruses are so weak when we inject it into the people to mount that immune response. But this is not, none of the COVID-19 vaccines are this type, you know. So don't worry, all the vaccines are safe for cancer patients. Okay, let's just maybe separate this out so that people get a bit of a clearer picture about who are the people that is not suitable to get vaccination. Prof, you want to start? Like, who's not suitable for vaccination right now?
I think the very weak patients may be, we have to be a bit more careful with them. If patient is like bedbound or having active infection, or patient is severely immunosuppressed, every time they check the blood count, the neutrophil is 0.5, they are on doxorubicin, IFOS, or that kind of very toxic chemo, then I think it's a bit difficult to give them the vaccine.
And that the reason being is just because they are so immunosuppressed, they may not mount a response, right?
That's right, yeah.
But I guess the only contraindication to the vaccines is actually having severe allergies, right? So the ones who have anaphylaxis or those who have all those very, blood clotting problems that need to be actually done in a hospital setting. So most cancer patients don't fulfill this criteria. Very few people, very rare to actually have severe anaphylaxis. So shall we just talk a little bit about this anaphylaxis thing?
Anaphylaxis, if you have anaphylaxis, you have known already because you had some injection or something in the past and then the blood pressure crashes and then you become very sick, short of breath, and then you have to admit you to ICU. So very few people have anaphylactic reaction to anything.
Yes, if you have any of these, it's not that you cannot get the vaccination. The doctor who decides to give you the vaccination has to go through all the drug history, the allergy history and all that. So that is better done in the hospital setting. So that is why the hospitals are given slots for their patients. So I think even in private hospitals, there are hospitals given slots, but they're not it's very uncertain when they're going to give these people the vaccines, you see. So I think all of us have to be very patient because, I mean, the AZ thing really has caused huru-hara, I would say, right? But it just shows how much Malaysians want to be vaccinated. But we do know that all of you, cancer survivors, are in the Fasa 2 that should finish rollout in August. So within the next 2 months or 3 months, we hope that all cancer patients who want to be vaccinated will get vaccinated through the MySejahtera. So we just have to be a little bit patient. Okay, so that covers about who should not get vaccinated and who should get vaccinated in the hospital setting. So there were some questions about mild allergies like eczema, right? It's safe to get vaccines when you have eczema and all that. What happens is that they will just assess you or keep you under sort of observation for about 30 minutes in the vaccination center. Okay, so even I have allergies, so I have to wait 30 minutes. My mother has allergies, so she had to wait 30 minutes. But otherwise, you can actually get yourself vaccinated in a community center. Okay, let's go to, shall we talk about side effects of the vaccines? People are very worried about blood clots. So especially our cancer survivors may be quite young, and the only reason or the only way they can get very quick means is through the AZ opt-in program. A lot of them have signed up for it. So what do you think, Prof, the blood clots, is it something of concern? Because like in the UK, they have come up with a guideline that says anyone below the age of 40, they should be given the choice of choosing what type of vaccines they want to go ahead with because of some, actually the reason for not putting the guideline very clearly for people younger than 40 is because they don't have enough data. And because there are not so many people vaccinated in this group, the number of blood clots, even though very rare, was actually slightly higher in the younger age group. But when you say higher, I'm sorry, I cannot share my slides, but let me share you some data, okay? If you were in the age group, like say 60 to 69 years old, and they're looking at the AZ COVID-19 vaccine. So in 100,000 people, okay, the potential harm is 0.2. So 0.2% is 0.2 over 100, which is 2 in 1,000, something like that. Okay, but this is not blood clots. This is any side effect. Doesn't mean it's blood clots. Maybe we should look at the blood clot figures because the numbers get a little bit higher when you are younger, and some more there's not enough data to support it. But we also know that what vaccines you can get first will help you to be protected against the COVID-19 virus. So given that risk and benefit type of, when you balance the risk and the benefit, probably the benefit is more, given that the transmission is quite high in our country. So I would say Am I muted? If you're younger than 40, it's a choice that you make to get vaccinated. Is mainly because you know the risk of getting a
Yeah, muted now.
get muted lah. I keep getting muted. I have no idea why.
I can't hear you. Yeah.
They keep on muting me. I don't know. Mr. Stephen, you trying to mute me?
No, I didn't do anything. I didn't do anything.
Okay, anyway.
I didn't do anything.
Okay. So, okay, just to recap, younger than 40, I think we have to make individual choices yourself. Decide whether you think you want to take up this vaccine. The risk of blood clots is actually very, very low, even in the young population. So, you know, but the risk of getting COVID-19 is actually probably higher than the risk of getting the blood clots. So by looking at that, you may choose to do COVID-19. A lot of people have, like myself, I've actually put my son who's only 20 into the AZ vaccination because I cannot, if he can get into the program, great, you know. And by luck, he actually got in, okay. But I felt that because the risk is actually low, compared to the risk of him getting COVID is higher in a very high transmissible area like us now, I would just go for it. You know? So it's an individual choice and decision. Okay, Profo, you want to add on anything to that? Not?
Yeah, so the risk of the blood clot is genuine. Is it a concern to us? It is. So I don't think there's a good answer to this question. So what Aisha shared actually is important for everybody to know. It is individual choice. I think from my personal point of view, if someone has a higher risk of having blood clot, then it is probably safer to have the Pfizer vaccine or Sinovac rather than AZ vaccine. But saying that the risk of the blood clot with AZ vaccine is still much lower than oral contraceptive pill, or even lower than tamoxifen. So we have to put it into the context. So by that same token, if someone is on tamoxifen, should she be taking the AZ vaccine or not? That is a good question. I would think ideally, patients should be given a choice to choose their vaccine. Hopefully that will be in the, like this in the future. So if you're on tamoxifen, probably you should take Pfizer vaccine if you are given a choice, or Sinovac vaccine, because both of these can increase the risk of blood clot. What about letrozole? Basically, all the hormonal treatment slightly increases the risk of blood clot. So letrozole less so than tamoxifen, but there's still a very small risk. But there's this question about, should you take aspirin to prevent blood clot? I don't know the answer. I don't know whether anybody knows the answer. Aspirin, I think, does reduce the risk of blood clot. The diabetic patient, high blood pressure, patient with heart disease, take aspirin to prevent blood clot. So it has a track record of preventing blood clot, but does it prevent blood clot in the vaccination situation? I don't think anybody knows. So
yes, and maybe we should also advise patients, because you know when you take aspirin, Panadol, these drugs are all anti-inflammatory, you know. So there are some guidelines like in the UK and I think in the US, they actually tell their patients not to take these drugs before the vaccination. That means a lot of people say, oh, you know, you don't want to get the pain, so take this medication before you go for your vaccination, which I think will mute your immune response. So, and not many people will experience fever, you know, after the first dose. I think it's about 1% of people will get fever and all that after the first dose, but 15% of the people will get fever and all this body aches after the second dose, okay? So I would advise not to take Panadol before the vaccination. You can take it like maybe a few hours after if you are really having fever. Otherwise, do not take these medications because it will actually mute your immune response. You want your body, your own immune system to actually react against the vaccine. So, you know, therefore, Panadol, aspirin, these are all drugs that can that immune response. Okay? All right. But for blood clots, as Prof Ho says, there's no evidence to suggest you do that. you may actually be using it and, you know, muting the effect of the vaccines when you're trying to reduce a very low risk of the blood clots. I think there's a question here about someone with low HB, Prof. Ho. Low HB, and the person is on olaparib and letrozole. Sorry.
I think the low HP, because if the patient is on olaparib, that could be the cause of the low HP. So that means olaparib suppresses the bone marrow functions. So, but that per se is not an issue. It's not a contraindication. So that patient can take the vaccine. Patient who has completed Herceptin a year ago is totally suitable for the vaccine. No issue at all. This patient's husband on chemotherapy, oxaliplatin and capecitabine, due for cycle 8, Y count is 3.3. He can have the vaccine, but since he's going to finish the chemo soon, he may take it after he has completed the chemos. But he wants his idostomy reversed. Depends on how long it's that. But I think we just register and then depends on when it comes up. If the vaccination date is after the idostomy reversal, I think we just do it. If it is before the idostomy reversal, I don't think it's an issue also. Reversal of idostomy is not really a big operation, so you can have it anytime, I think, with no
so maybe some
contraindication.
comments about, you know, having the surgery and vaccination. What's the timing? How should the timing be like? There's no real problems with vaccination and surgery. The only thing is that when you have the vaccination, you may develop those side effects that we talked about, fever, body aches, you know. So these symptoms may actually make the anesthetist cancel you, you know. That means they will reschedule your appointment for the surgery, because anyone who has fever, we will not be operating on those patients. So the side effects of the vaccine may actually make you not suitable for the operation. So don't have the vaccination like very close to your surgery date. So maybe you should have it like 5 days before your surgery. If at all, you know, you need to go for the vaccination and you have surgery to plan, because you don't want the side effect of the vaccines making you not suitable for the surgery. And it's just because you have fever from the vaccine. It's not because you have a sore throat or something like that. That would make the anesthetist cancel your case, okay? Then the other thing, when should you wait after surgery to vaccinate? Same thing, after the operation, sometimes you can get side effects or complications from the surgery. So having fever because of vaccination may mask or may even make it difficult and confusing for the doctors, you know. Don't know why you're having fever after this surgery. Is it because of the vaccination? Is it because of the surgery, you know? So it's good to space out the vaccine and the surgery. But there is no contraindication to having vaccination before or after the surgery. It's just the timing, so that the fever does not cloud the issues surrounding the surgery. Okay? All right, so that one is about surgery. I think there's a question about statistics. I think this one, I don't think we can answer, right, Prof?
No.
Yeah, unfortunately, we won't be able to answer this. But we do know that if, let's say, you have a side effect, you can actually report it in your MySejahtera. There is like I think you can report any side effect. I think if you have fever, you can report, you know. I didn't do anything because I didn't get any side effects. Do you get any side effects, Prof?
So for 2 days.
From your vaccination? Do you have fever?
Yeah, no fever.
Really?
I was sore for 2 days. Yeah.
Yeah, I had just the local thing, but otherwise was no like that.
Some of the nurse they have fever for a few days.
Yeah.
One nurse had shingles.
Right? Pardon?
One of the nurse has shingles.
Shingles. Wow.
Yes, she was quite sick for 1 week.
Oh dear. So that's why. So I think
the rest are fine.
Actually, a lot of young people may have more side effects, right? Maybe the immune response. Okay. So far, no new questions. We haven't got any.
There's an old question here. Is there a program by ppum to provide vaccine to cancer patients that seek treatment there? Noted some patients at ICANN get their vaccines there. Yes, the answer is yes. So we are offering our cancer patients vaccination. We started last week, so we have vaccinated quite a few patients already. The program, I think, will run until August. So, but I don't know how many hospitals offer this. Currently, we're only offering for UMMC and UMSC patients. But if patients are from private hospitals and they have nowhere to expedite their vaccination, I think we can still put you in our waiting list. If there is some surplus of the vaccine, we can still offer it to you. It will be the national vaccination program. Maybe you can give us your.
But as I mentioned before, the program for My Sejahtera actually goes on till August.
Yeah.
So I think we have to be confident that people who have cancer will get vaccinated, you know. I mean, the thing about My Sejahtera is they'll just contact you like 1 or 2 days before the date, you know. So I think we just have to be patient. And then now the government is saying that they may be offering the, you know, you can actually choose what vaccines you want to take, right? So maybe it's good to be patient and wait for that system also. There's a question about what happens if they have registered for AZ and they want to change. I think this is not a question that we can answer, but I think what you can do is to communicate with My Sejahtera. Okay, that one we can't answer, unfortunately.
Yeah, I just don't want to be too protective of the UMMC patients. If the slots are not all taken up, so there's no reason why we can't offer to patients from outside.
Hey, actually, I just got some information that in HKL, they also offer this, and there's very few people that actually taking it up in HKL. So maybe we should be, you know, like, I think all of you, some of you are a close, you know, you have a close relationship with HKL as survivor support groups or something. Communicate with the doctors there. They may be able to organize something, because as far as I know, the surgeon over there was trying to organize, but they found that a lot of people didn't turn up for their vaccination. So I think I'm not being protective of UMMC. I think we are open. It's first come, first serve. But we do recognize that I think for Prof Ho's department especially, I think the priority should be given to people who are actually on active treatment so that they get their timing done correctly, you know. You can it's easier for them to adjust. But yeah, I think we should try to fill all the slots as much as we can. So PPUM, if you are a patient, if you come over to the clinics at any time, please tell the doctors that you're interested in the vaccination. They will put you in the list. And for patients from HKL, please inquire from HKL and see how you can get into that pool, because that pool is not being taken up at the moment.
So this patient had a lot of side effect after her vaccination on 11th of May. Short of breath, fast heartbeat, giddiness, which subsided a little bit after a few days. Yeah, I totally agree. Some patients get more side effect than others. Some people don't get side effect at all. It depends on the immune response, I think. Because you're not injecting the virus, you're injecting the RNA that produce one of the protein of the virus, and the immune cells will react to the protein. So it is an immune reaction. It's not an infection per se. It's an immune reaction to the protein manufactured from the RNA.
Okay. So actually, these symptoms is going on for 2 weeks now, right? So maybe, you know, I think we have to be aware also, yeah, because the COVID-19 symptoms apparently is not as straightforward as what it used to be. So if you have any doubts or any worries, please go and see a doctor. It doesn't matter, it could be your general practitioner, you know. At least you go there, have it checked and make sure your oxygenation is good. Okay, so I would suggest if it's already 1 week after the vaccination, would it be that long, you think, Ho? This is
it's
more
possible, but when she was just vaccinated, she may not be protected just yet. So it is totally possible that she get the infection at the same time.
Exactly. You could be having, I mean, please don't take this personally, you know, you may not have COVID-19, but if the message is, if you are sick, please see a doctor. It doesn't matter which doctor, just see a general practitioner and make sure you are assessed so they can recognize some things we don't recognize ourselves. The doctors are more they can recognize it better, especially sick patients. Doctors can recognize them very well. Okay. Right. Can a recovered COVID-19 patient take the vaccine? Praho?
The current Malaysia guideline, I was told, is that after they have recovered, 3 months later, they can have the vaccine. Their thinking is that if the patient recovers, then they have mounted an antibody response to the infection, but which may not be sustained. So they still need the vaccination to give them more boost. You want to generate more memory T cells. The memory T cells will protect you in the long run. Yeah, so that is the idea. After 3 months, they can go for the vaccine, which that means you have to register now because you probably wait for 3 months to get the vaccine anyway.
Yeah, and even though before 3 months is okay really, because I think if I'm not mistaken, I heard Prof. Adiba told us that actually you only need like if I'm not mistaken a week or something like that. That means it's safe to get vaccinated. It's just that the Malaysian guidelines say it's 3 months because they want to prioritize people who are, you know, who have not been vaccinated or exposed to anything, you know, to mount an immune response. So if you are scheduled for your vaccination and it's just like not even 3 months after a COVID-19 exposure, I think you can still go ahead and have your vaccination, you know.
Yeah.
Okay, but of course we don't know lah. When you're at the vaccination center, the doctor there may tell you to come back, you know, 3 months. But I think it's okay and it's safe to get vaccinated even before that 3 months.
So Mr. Tam, you can have the vaccine. You just contact Alice or one of my colleagues. You are an MSc patient, so we can offer you the vaccine.
Okay, this thing about offer caregiver vaccination. So this one, unfortunately, we won't be able to answer this question. I completely agree with you, especially if even elderly patients, especially those at home who are not mobile, they have caregivers. But unfortunately, we won't be able to answer this question. I mean, you can advocate for it if you want to ask us to write a letter. We did ask, like I think we did write, right, Mr. Wong? The first letter we wrote to STAR, I think we did ask that caregivers also prioritize for the vaccination. But I guess right now, I think we better get the cancer patients vaccinated first. Okay, most important.
Yeah, I think now actually is to persuade everybody to get vaccinated, because last time they were hesitant about this AstraZeneca. And there's another thing about caregiver are those people who are staying with multi-generation families. Those are also very dangerous because those young guys go to work and mix around and take back the virus to the elderly people who are very vulnerable. So maybe these are the few things we have to address in the future. Okay, go ahead.
Okay, I think there's a question about someone being on chemo and suitable for the vaccine. I think we already answered this question earlier. Anyone even on chemo can go for the vaccination. It's just the timing. You need to make sure your white cell is at a good level before you go for the vaccination.
Yeah, this patient is on FEC followed by docetaxel. So this regime will take about 4.5 months. I think you can register now because by the time you get the appointment, the chemo is probably over already.
Okay, this type of patients can actually ask their doctors, you know, when they're going to for the chemo, whether they can get their dates in the hospital, right, Prof?
Yeah.
Because it's easier to manage, right? Okay, somebody asked about when are you protected? How long? Oh, it was Ranjit. How long after first or second dose is one considered protected? Okay, this one.
The immune cells will need at least about 10 days to 14 days to mount the antibody response. So I would think probably at least 2 weeks later when you have some degree of protection.
Yes. Remember that you can still get infected even if you are vaccinated. So a lot of people don't really agree with the American style of changing SOPs. You know, they have sort of gone away with the mask for certain things and they've allowed large congregations and all that. Not many countries actually agree with that. So even if we are vaccinated, we still can be infected and we can still transmit the virus. Although the evidence are very encouraging, it shows that, you know, transmission is lower, the severity and the hospitalization of patients are lower. You can see this in America and all this. But then, because we don't know whether we are still able to carry it through, please continue the SOP. So the public health things like wearing a mask, washing hands frequently, these are still, you still need to continue doing that. So for all of us in the hospital, if a doctor doesn't wear the protective equipment, even our medical students, they can be reported to the director and the dean, you know, because we recognize this is a very important part of the, one thing is to protect ourselves, we also have to protect other people. Okay? All right, so I hope we answered that question. Okay, would you recommend breast cancer to take vaccine in the early cycle of chemo? During the first or second chemo cycle, if there are a total of 6 cycles. Okay, Prof Ho, this one is your area.
I can't see why not. If you have the appointment, yes, do it. Yes, there will be some side effects. So you suffer from the chemo side effect and some of the vaccine side effect. Yeah, but I think with the current infection rate, earlier you get the vaccination, the better. Patients who are on long-term high blood pressure cholesterol medication, I don't think they should stop the medicine. They should continue when they are on the vaccine as well.
Yes, this is a very important question. So I think we can send a link to the guidelines. I mean, difficult to read because it's for doctors, but essentially, if you are on any medical treatments, even if you are on blood thinners like aspirin or Plavix, you can continue these drugs. If you are on two blood thinners, you may want to stop one of them like a few days before the vaccination. But otherwise, for most patients, these drugs need to continue during the vaccination.
Patient's husband on oral chemo capecitabine. Capecitabine is not a very toxic chemo regime, so I think he is free to take the vaccine anytime.
Okay, there's a question about which vaccine is more suitable. I think we answered this already just now, Prof.
Yeah.
Agree that all patients, all vaccines are safe for cancer patients.
Now, why is second dose of AZ vaccine given so much later, after 28 days? Is it 28 days or 3 months? It is after a long time after the first
Yeah,
dose.
in fact, the longer had better efficacy, but the 28 days was something like a protocol they use. So I think people are trying to space it out further so that more people can get vaccinated. But our supply is actually limited, right? So if you can delay the second dose, you get more people vaccinated. So that all is depends on the research that's being done, and I'm sure it has some scientific reason lah. When you boost the immune system, when you boost it again, when is you get the best coverage, you know. So I think we don't really need to understand these mechanisms, but the most important thing is you mustn't miss your second dose. If you are, you know, like you forgot to go for your second dose. There are a lot of people like in Canada, they only use 1 dose and they haven't got around doing the second dose or something like that because they are thinking that if they can get more people vaccinated, is better. That means at least everybody gets 1 dose. But they don't recommend this. And I think the Malaysian SOP is also not recommending this at the moment. So please check that you are going to go for your second dose on time. So Pfizer is 3 weeks, right? It's not 2 weeks.
3 weeks, yeah.
Yeah. Okay.
Which vaccine is given for EMSX patient? I think currently they are still giving Pfizer vaccine, but it's in the national program, so it depends on what national program you use. So in the future, I think they want to put in AZ vaccine as well. So I don't know what we could give in the future. Can an ex-COVID patient contract COVID again if not vaccinated? I think the answer is yes, isn't it?
Dr. Ho, can I ask something?
Yeah.
I am taking simvastatin for cholesterol, HUKM, then pressure, enalapril, then I am taking cardiprine, and also for diabetes, diamicron. Am I eligible for this vaccine?
Yes, you are.
Don't know whether you got an answer.
Yes.
Yeah.
Okay, there was a question about the doctor at the vaccination center told me generally the efficacy of vaccines only around 70% for cancer patients. Any data so far to support this?
I don't think any strong data just for cancer patients, to be honest. But if the doctor expect slightly lower efficacy if patient is on chemo or something that suppresses immune system, I think that's not an illogical deduction. I think it's not just about the protection against the virus infection, also protect against severe infection. So all the more reason why the patient should be on, should have the vaccine.
Okay, I think there's some questions from Facebook. Mr. Steven has passed to me. After taking my first dose, while waiting for my second dose, can I have a colonoscope and a blood test? I think the answer is yes, right?
I see why not.
Yeah. Yeah, you can go ahead and get all your tests done, even though you are in between the vaccines, you know. Okay, this question is, I did my treatment in private. So how can the government hospital recognize us as cancer survivors? So I think what they mean is how can they get into some sort of a vaccination, hospital vaccination program. So I think the easiest answer to this is to register for the MySejahtera. If you have cancer as a comorbidity, you definitely will get your vaccine by August this year. So of course the government, it's not that we don't want patients to come over, but you know right now we are trying to, how can I say it, Prof? Are we running at full capacity?
Actually, oncology, our department's vaccines, the take-up rate is very high. So actually, a lot of people wanted it. So I don't know why HKO has low take-up rate.
Yeah, that's why I think we the private patients, those who have never had treatments in government, it's not that we do not want to open up slots for vaccination for everybody. It's just that I think it's all about prioritization again. As what Prof. Ho mentioned earlier, you know, a lot of people on chemo and all they may need to have some special timing with regards to their vaccination. But if let's say you are really stuck, you are not able to access in any way. And I think this is not really true, because if you are registered to MySejahtera, you should get vaccinated before August. You know, by end of August, Fasa 2 should have been completed. And you should be one of those people who are in the national vaccination program. But if you're really stuck, let's say you're not well, you have a lot of medical issues, you can talk to your private oncologist to refer you on. There's a very good network between the private and public practitioners, you know. They can ask these questions. If the patient has a real need, we never turn anyone away, right, Prof?
Yeah, definitely.
Yeah, definitely. Okay.
This patient had completed 10 years tamoxifen in December. I think it's perfect timing. Yeah, you can have the vaccination now.
I will be taking my first dose on 13 June. Is it okay I go for my BDM? What is BDM?
Bone marrow density.
Oh, is it? Bone mineral density. BMD, is it? BMD test?
BMD, yeah.
BMD? I think should be okay. Should be all right. I think the worry about tests and vaccines is because of the mammogram story. Have you all heard about the issues with the mammogram? People doing mammogram and they get false positive. False positive just means that the mammogram shows as if this person has cancer when they didn't, right? The reason is when we get vaccinated in the arm, we have these lymph nodes that may swell up in the armpit. So when you are going for, let's say, a mammogram or an ultrasound of the breast, this may show up like very large lymph nodes and it becomes very confusing. So what we recommend is for those who have, like, say, a scheduled mammogram, that means there's nothing wrong with you, you're just going for your screening mammogram, you can get it done 6 weeks after your last dose. After the second dose, you do it 6 weeks after that. Okay, or you better still do it before you go for vaccination so that any enlarged lymph nodes does not confuse the doctors, because it may be quite confusing. We don't know whether this is just a reaction from the vaccine or it could be something like a cancer. Okay, and for cancer patients, we recommend that you have the injection in your other side, in the other arm. So let's say if you have right-sided breast cancer, have your vaccination on the left arm. Or if you have both sides breast cancer, then you can even get your injection in the thigh, because the injection is given in the muscle. So it can be given in any muscle in the body. Okay. Actually, I wanted to bring up this thing on the slides, but I can't share my slides. There is this thing called the pre-vaccination assessment, which is a letter written by your doctor. So that will be easier for the people at the vaccination center to sort of help you get through that process. So this letter is a very common template. It's circulated everywhere. I think in all our clinics, we have it already. We have to write a letter for you to state whether it's safe for you to have the vaccines and whether it's safe for you to have the vaccine in a community center or you need to have it done in a hospital center. So if you as cancer survivors, maybe it's easier for you to get this done by your own doctors, your oncologists or your surgeons. Or if it's difficult and you are like you're a long-term cancer survivor, you can see your GP, You see your general practitioner doctor, ask them to help you fill up these forms. These forms are signed by a doctor, a medical practitioner. Okay? So do you have these forms in your clinic? Do you all have to
We give them to our patients. Yeah.
Yeah.
I think I should just answer Sally Wang's question about vaccination and PET scan. So there is a small risk of causing false positive scan if the patient develop a lot of reaction to the vaccine with swollen lymph glands.
Yes. But we want to also send a message across, like if you have something new, like maybe you felt new lymph nodes and you're worried, you do not want to go for the scan or just because you want to go for your vaccination. Sometimes in that situation, just see your doctor so that the doctor can come up with the diagnosis for you quickly. And because they know that you're going for vaccination, all that, so it doesn't cloud the picture too much. So people with symptoms shouldn't delay seeking any form of attention from the doctor. Get it sorted out early rather than later. But for those who are doing screening, that means you are quite well, healthy, no problems, no issues, those you can delay, those mammograms that we use for screening. But for those with active new problems, with lymph nodes, swelling, or anything like that, get it sorted quickly. See your doctor so that we can sort it out as soon as possible. Okay.
No more questions. Are we done?
Yeah, are we done? It's already 5,
Yeah.
Yeah, Mr. Wong, I think we are almost done. It's time for you to maybe give some closing, Mr. Wong.
Just one. The AstraZeneca, they said most likely we will get the second dose after about 3 months, 12 weeks. Now, whereas Pfizer, I think is 2 or 3 weeks, So the question is, can the first dose give enough antibodies to give us enough immunity for the second dose? Before the second dose?
It will give you some protection. It will give you some protection.
Say again, if what?
It will give you protection because the patient would be exposed to the viral DNA already. So after the
so preferably will be narrow then. If we can persuade or you can get another second dose about maybe 1 month later, it will be better.
So this question, I think, Mr. Watt, is a public health question, because
yes, that's what I was wondering.
It's a limitation of the vaccines worldwide that a lot of the countries choose only to vaccinate 1 dose, because they don't have enough, the supply is limited, or maybe they have funding
Yeah.
financing issues. So there is some evidence to show that after one dose, it does have some effect, you know.
But why limited to AstraZeneca? Why don't they do it to Pfizer, for instance? Why don't they say Pfizer, you also can spread it out to get more people
It's
vaccinated?
not like
I
that.
agree with you.
They didn't
Huh?
really spread out. In fact, there are a lot of studies going on. In fact, they say, okay, you do first dose Pfizer, second dose do AZ. Is it better or is it not better? So there are a lot of these things happening right now. It's
I know.
observational studies right now. But in terms of the studies, because all the practice, all the SOPs for the vaccines is based on the clinical trials, and the clinical trials are the research that was done to show the efficacy, right? So when they did these trials, that proven efficacy was because of that protocol that they used during the study. So during that study, they had certain duration, like when they should use the second dose, what was the duration that is needed for the second dose. So I think the AZ showed that even the longer duration actually had better efficacy. Okay, so again, this we leave to the, you know, our the committee is actually looking into all this to see how to balance the access so that more people get coverage, and the evidence that we already have, because you cannot just simply do as you wish, you know, because you show efficacy because of that clinical trial that followed certain rules, like how many weeks in between we showed the efficacy. So suddenly we change the rules. Are we going to get the same efficacy? We don't know, you see. So that has to be done properly, and I think we leave that to our the committee, you know, to decide this.
Yeah. Yeah. Okay, I think, well, that one is beyond our control. Yeah, it's a balance between the availability of the vaccine to the whole country and the what you call efficacy enough to cover, to reach the second dose. Doctor, in fact, explained to me, actually, I don't quite buy it, is that when I got vaccinated, they said, no, this one is even better because Pfizer only can last about 3 weeks, whereas AstraZeneca, you can last longer. But anyway, that is,
no.
you know, those.
Doesn't mean that way, Mr. Wong. It doesn't mean that way. It doesn't mean that the last how long, you know. It's about how, what is the efficacy at the end.
Yeah, but he keep on saying that that's what the result they tested in UK. You know, that's why the COVID-19 cases in UK is dropped so drastically. But anyway, okay, I think we learned a lot.
Mr. Wong, before we end, I think we should talk about the last thing now, which is the public health thing, which is the what do you call it? The not crowd lah. What's wrong with me? Herd immunity.
Herd immunity.
I think people don't recognize their role. You are doing it for yourself, but you're also doing it for other people lah. So in fact, the Muslim we have this bahagian agama that actually look into it and say that it's our duty, you know, it's like almost a duty to us to do it because we're going to protect others, you know. So I think to understand that, Prof, do you want to just say a little bit? Do you think you can say a bit on this public health matter, which is herd immunity?
What to say? So
explain what is herd immunity. Why do we need about 50 to 70% of the population vaccinated to protect everybody?
That's why I say if enough people are vaccinated, the vulnerable people don't need to be vaccinated because other people will protect you. The virus won't become an epidemic. So, but if not enough people are vaccinated, the vulnerable people have to get vaccinated themselves to protect themselves first. Yeah. But if everybody is vaccinated, then the very weak, very old ones, they don't need to get vaccinated because the virus will not have an epidemic in the community. But except you can't go overseas because you're not vaccinated.
The other places are not vaccinated also, right? So it's almost like a global problem getting the herd immunity because you can have 50% in Israel, you can have 40% USA, but if you can only get 3% in different countries, you will never end the pandemic. So I think it's a global responsibility to get everybody vaccinated. But if you can only get 3%. Oh my, I think the volume something wrong. Sorry.
It's okay. It's okay now.
Sorry. Yeah, so I think the herd immunity is about all of us trying to get vaccinated so that we protect each other lah. It's like if you don't transmit, somebody else cannot get it. And once we kill off this virus in a way, the variants don't turn up. The longer the virus is in the community, the more variants they change and they become more virulent, more dangerous to the community. So that chance is reduced tremendously if we get vaccinated quickly. So I think all of us want to get vaccinated. It's just that, it's a slow process. So please encourage everybody to vaccinate. And if you have any questions, really, we also have another session next week with Prof. Maniza this time. We will be doing it in Bahasa Melayu. Hopefully we can come together and get everybody, hopefully we aim that all cancer patients get vaccinated by end of August, okay? Because that is what the government has promised us. So I think if you all have any issues, any problems, Mr. Wong, you have a group of people, right? Helping to help people register if they have issues, right?
Yeah.
Yeah.
Okay. All right. Okay. Okay. This is closing. First, before I thank the two experts, I would like to point out a few things. I really advise you all to join TAC. In fact, you benefit more than by not joining. And we are the cheapest organization. We only 40 ringgit for whole life member. And as I said earlier, I think average once a month we have a similar webinar in which you can learn a lot, and in which we invite all the experts or specialists, oncologists or whatever have you, and to give talks, and they are very useful.